Okay, good evening, everyone. My name is David Goldenberg, Supervisor for Tuolumne County Board of Supervisors, District 1. And I am sitting in for our board chair, Ryan Campbell, this evening. Ryan is actually celebrating his anniversary with his wife, Haley, and asked me to pitch hit for him. And so I'm glad to do so. I've been participating in these as I could. And so here we are, we're moving forward, making a lot of progress, with our efforts to combat the COVID-19 pandemic. And we're making good progress. Unfortunately, we remain in the orange tier. We've been very close on the edge several times to the yellow tier, but we've had a few cases, come up here and there in the last few days even. And so it points to the reasons that we need to remain ever diligent and think about the values that we get from the vaccinations. Vaccinations are very important, and the more people that we can get actively being vaccinated protects everybody to a greater depth, throughout the county. So welcome. I'm glad you're here. We've got a few people on this evening that will be presenting. First of all will be Dr. Sajenko, our interim public health officer, and he will be followed with some comments by Michelle Gichetta from our public health department. Dr. Alex Hurd from Adventist Health Sonora unfortunately ended up with a last-minute commitment, so he could not participate tonight, but we did get some information from them, and we work closely with the hospital each and every day. So we're constantly in tune with them, and so I'll turn it back to Dory to kind of give some ground rules here for the session.
Awesome, welcome, and thank you, Supervisor. Dory Beets. I am the Office of Emergency Services Coordinator for the County of Tuolumne. And just so you, just some ground rules with our Zoom information night. Please make sure you're on mute unless you're talking. If you'd like to ask a question, you can raise your hand or we'll open it up throughout to ask questions. Or if you feel like just putting it in the chat box, we can reach it that way. So we thank everyone for participating, and we will go as long as folks want to ask us questions within the hour. So we try to get done by 7 p.m. At the latest. So thank you again. And just put in the chat box if you have any questions, or when we open up, you can ask them at that time.
Very good. So Dr. Sajenko, if you could lead it off here and give us an update.
You bet. So good evening, everyone. Thanks for joining us. So to put things in context, I'm going to start with a global view and bring us down to Tuolumne County. And certainly, I think that's important because all of us are looking at the news and seeing what has happened in India, where they've topped 400,000 cases per day, several thousand deaths per day. So truly a tragedy happening there. And as Supervisor Goldenberg referred to is, I don't think we have the possibility of that, but really what is preventing that from happening in the United States is those non-pharmaceutical interventions, the social distancing, the mask wearing, those things that we've done since the beginning of the pandemic, and the layering on top of that vaccination. So, sort of in the world, we're looking at those hotspots in entire countries such as India being impacted. But then if we come into the continental United States, we're seeing hotspots there. Initially, we saw it in Michigan. That was being driven by a variant of the virus called the B117 variant, which is out of the United Kingdom. We saw that move from Michigan into other places such as Minnesota and then Pennsylvania. And then we're seeing other hotspots come up. In Florida, it's Miami-Dade County, where they're seeing their ICUs go into surge. And then just to the north of us in Oregon, 15 counties, they have a similar tiering system to what we have currently, is they saw 15 of their counties move back to the most restrictive tier, where they're seeing even rural places in Oregon that are seeing their healthcare systems being stressed. So that's kind of the world view and the country view. And then what I'm going to do, if I can, Dory, is share my screen. Let's see. Here we go. And bring it back to California. And you should be seeing the map of California. And that's the tier map that comes out every Tuesday. As compared to our neighbor in the north, we are currently having the lowest case rate of any of the 48 conterminous states in the United States. So we're a little bit having a higher case rate than Hawaii. And actually, I think with Alaska, with a surge going on in Fairbanks right now, we're actually having a lower case rate statewide than any other state than Hawaii. And that included, as of yesterday, 4 more counties moving into the yellow tier. And unfortunately, as Supervisor Goldenberg indicated, we didn't quite get there. That we are really, really close, and we are solidly in the orange tier. I don't anticipate that we will be moving back to the red tier at any point in time. So looking at our own county and looking at our neighbors around us, we're the light blue line. The red dotted line and the orange dotted line are the case sort of thresholds to go either back up into the red tier or go below that orange line, we go into the yellow tier. So as a county, we're doing well and decreasing our case rate, moving into the yellow tier. But nicely enough, we're also seeing that decrease in cases in our neighboring counties as well. And so again, I anticipate that things will continue to go reasonably well for us in terms of continued decline in cases. But I think, again, one of the messages is continue doing those non-pharmaceutical interventions, do those things that decrease transmission. Let me see if I can get out of the PDF slides. And then we'll close that. And go to the next thing I really wanted to talk about was our current status with vaccines. And again, we mentioned this to the board yesterday. We have 16,000 people that are fully vaccinated and at least 21,000 people that have received at least 1 dose. And we've really protected well our oldest and most at-risk population, with about almost 70% of them, or just over 70%, or 3/4 of them, fully or partially vaccinated. So that is a really good coverage there. Almost as good with our 50 to 64-year-olds, but where our real area of concern is the 20 to 50-year-old group. In here, it's the 18 to 49. That group haven't had really good vaccine uptake, only about 25% of the population in that group. And the concern here is that is who we're seeing as cases right now, people who are being hospitalized, but also serving as mechanisms for transmission to those at-risk groups. And so this is a group that I'd like to see starting to get a little more vaccinated. And I'm sure that Michelle will go into details about our vaccine clinics, where we're offering them, when we're offering them. And then really what we want to do is, recognizing your concerns, address any questions you may have, and encourage you again to get vaccinated. So I'll stop sharing the screen there and hand it over to Michelle.
Okay. So thanks for that overview. And I guess I'll just add a little bit more about our vaccine clinics. We have fully transitioned into that statewide registration and notification system for vaccines called MyTurn. So everyone interested in getting their vaccine can go to myturn.ca.gov, and so that you can be notified when a clinic is open near you. You can also still get a vaccine as well at pharmacies like CVS, Rite Aid, Twain Hart Pharmacy, Groveland Pharmacy, Those places are still, thank you, Dory, for putting the link in there, are also still offering vaccines. So we have been holding clinics. We had a Pfizer clinic yesterday, which was really great. We have a small clinics coming up on, most of the time we do them twice a week, Tuesdays and Thursdays. Some of them are, just for second doses to cover those who've had their first doses, but still continuing to offer those. So we've been doing large mass vaccination clinics for some time, since December. We may be moving indoors as the clinics get a little bit smaller and it gets hotter outside. It's the heat out on the pavement tends to, be kind of draining for the staff and for the folks in their cars. So we're going to probably shift toward indoors, and we'll keep everybody posted on that. But we have plenty of vaccine for everyone. We really encourage everyone to go ahead and get vaccinated now before the summer, before travel, before summer activities and graduation and that kind of thing. And we are doing the Pfizer vaccine now. We've got Pfizer vaccine available, which is available for anyone 16 and older. So yeah, and I, encourage everyone to follow us on our Facebook page, on our county website, tuolumnecounty.ca.gov/public health. And we've got a whole vaccine page there with information sheets on the different vaccines if you have questions about the kind of vaccine that we're giving. And again, here to answer questions if you have any concerns or questions about the vaccines, and hoping to increase the number of folks vaccinated to keep Tuolumne County safe, protected, and get our case rates down into that yellow. And even if we do, are able to move beyond the blueprint in June, we want to make sure as things open up that we are layering on those protections, like Dr. Sergienko mentioned, that we're vaccinated first of all, and then continuing to follow the masking and the distancing and all that, so that we don't see a rise in cases as we open up.
So thank you very much, Michelle, for running that information down. It's very informative. A couple areas come to my mind that maybe you could expound on a little bit. One of them would be the as we transition a little bit, we've had these mass clinics for quite a while. They've been very successful. And as Dr. Sergienko just indicated, we have some age groups that, we still want to target that, we feel we're a bit low on, and that it would be helpful if they join the party, so to speak, and, get vaccinated as well. But, perhaps as we move forward, I've heard some discussions about perhaps another age group that may be coming into play, as well as that we might be looking at our pharmacies, which are already doing a tremendous job, and they're vaccinating a lot of people, and we have a lot of pharmacies in the county. Perhaps that we might be moving towards that platform maybe a little bit more. Maybe if you could speak to those areas.
So I said, I'll go with the age thing first. Okay, is that we do know that the FDA, what's called the Vaccine and Related Biological Products Advisory Committee, or VRBPAC, is reviewing the data for approving the Pfizer vaccine for ages 12 to 15. And if they do approve it, then it will move to the CDC's Advisory Committee on Immunization Practices. And ACIP, as they're known, is already set up to meet on Wednesday. And then if they do approve it for that age group, then the Western States Scientific Review Group, which is a coalition of epidemiologists and vaccinologists that work with the California, Oregon, Washington, and Nevada, will review that data for our residents, make sure it's a safe product. And if they approve it, then it may be as early as Thursday next week that we would be able to, our CDPH would be able to roll out the California Department of Public Health guidance on administering vaccine to the 12 to 15-year-old group. So we could start potentially vaccinating that age group as early as next Friday. So that's exciting. Again, another group that we know is potential spreaders, even though we know kids in that age range tend to have very mild cases of disease. So Michelle, other thoughts about the clinics and how we're shifting gears?
No, I forgot to mention too that not just moving inside, but also we continue our efforts to reach out to those who may have difficulty getting to the clinics or are in more vulnerable locations or populations that just have difficulty, gaining access to the vaccine. So we will continue those efforts working with our partners, such as those who serve people who are experiencing homelessness or who are homebound. And again, we all know that Groveland's kind of in a way over there across the river, and so making sure that that we support Groveland Pharmacy in their vaccine efforts, and working with Mariposa County and those areas that kind of lie between both of our counties. And so we are looking at options for mobile clinics as necessary, and we have a good relationship with the county schools and coordinating with them, and as the age groups move younger, and working with them. So just more, I don't like the word target, but targeted clinics and mobile clinics and such will be our focus in the coming weeks and months.
So absolutely, and you made some really good points here, Michelle. Our community over in Groveland, they are somewhat removed, and it's a pretty good trip, to come to town, so to speak, if they're coming over to Sonora area. So the efforts there are truly appreciated, by the people that live up there. It makes life a lot better for them than to have to make, half an hour, 45-minute, one-way trip each way, depending on traffic and stuff. So that's really good. And the mobile clinics, there's some interest in that. Certainly, certain groups of people that allows us to reach out, to the community in ways that, they might have difficulty, getting in themselves. Also really appreciate, that we have this constant flow of communications, with Kathy Parker, the County Superintendent of Schools, and that we're working with them. We've had good success in that area, with our 16 and 17-year-olds. And as we move forward, and if we see the approval, coming up of the a little bit younger age year, that'll be beneficial as well. One thing that, I kind of wanted to just put out there too and stress is that, Dr. Sachenko made, some comments about, our county and the adjoining counties, typically, the ones that we see, flow, real often back and forth is Calaveras County, Mariposa County to some extent, so that the more that the counties do and work on their programs, it just becomes part of the entire, program, right? So that we protect each other by getting vaccinated and working together. And we're in really good communications. We have, conference calls every week, with cooperators, and not just within the counties, but within all the different organizations and our federal cooperators, from Forest Service and BLM, City of San Francisco, all the utility companies. We're in communications with all those folks. And so this truly is a joint effort and works really good. So at this point, I'd like to turn it over. We don't have that many people on the call tonight, but Dory, do we have some questions that are coming up here?
There aren't any questions in the chat box, but if anyone wants to unmute themselves and ask a question, we're here and ready to hopefully try and answer those.
So I will say, recognizing that the two folks that were on, I think, are both from the Boy Scouts of America, is that we're eagerly waiting for the summer camp guidance to come out. So as soon as we see it, we will send it your guys' way. Just got off a call with the California Department of Public Health, our weekly check-in call, and that question has been a recurring one for about the last 6 to 8 weeks. And so we know the CDC guidance is out there, and I asked Trudy Raimondo, who's the lead for the CDPH guidance, it will look like the CDC guidance. And so if you start with that as a base, that might not be a bad thing. And actually, I've got that handy, so I'm going to put that link in the chat box. I think the other thing that we all kind of be aware of is that the current restrictions or the current guidance that comes under the Blueprint for a Safer Economy will largely go away after the 15th of June, all those sector-specific guidance. And then it'll kind of switch to a broad set of principles, social distancing, wearing masks, hand hygiene, the things we kind of started out the pandemic with March 2020, and then layer on top of that vaccinations. There will be some still guidance about youth groups, so sports, schools, and then the other thing I know that's going to be happening is, I won't say extremely large, but large group gatherings of 10,000 or greater, which I don't think would apply to us in most cases. So that's kind of what we know for the transition from the current blueprint mechanism to what they're referring to as beyond the blueprint. And that is what I know about that change that's coming up, again, as early as the 15th of June. And I anticipate, given our current case volume and case rate, that's exactly what's going to happen, because the two conditions that need to be met are a decreasing case rate and vaccinations available for everybody, along with not having the healthcare system in surge, and we are not seeing that at present.
So thank you for that, Dr. Sajenko. That's good, information looking forward here, because, all of our different youth groups are very important. There's a lot of summer camps that typically are operational, in the area, all through this region, including, Calaveras, Tuolumne, Mariposa counties. And so having the opportunity, for those youth to get out there, get reconnected, and, they've been under a lot of stress and strain for a long time, and they're eagerly waiting. I know, my son and my grandson, they live over in the Reno area, and, he's of a bit of a younger age. He's 6 going on 7 shortly here, but he's really missing, having those connections. So it's very important thing, that we move forward with that. But we have to, as you stated, we have to wait until, we get the information coming down through the state system, and we, keep our rates at the availability where we can do so. Anthony, I saw you had your hand up there for a moment. Did you have a question or a comment?
No, that was just my dog running by.
Excellent.
I gotcha. Any questions from our our Boy Scout groups here? That Dr. Sajenko would be glad to expound the best that he can, with the information that he has.
Not really. I mean, I think we're waiting for the state guidelines, just like you are.
Yeah, and like I said, as soon as we get them, but if you start with the CDC stuff that I put in the chat box, that's a good place to start if you haven't started working on a plan.
Oh, we've definitely got a plan.
Yeah.
Yeah, I was going to say probably there's a template that's come down through your organization down to you. We've noticed that with other, and actually the I guess you guys have a professional organization that has already developed guidance. It's actually goes hand in glove with the CDC guidance. So yeah.
Yep. And typically that's been an area of some frustration for many different groups, right? Whether it be us as individuals, whether it be for businesses, organizations, schools, we see things that are happening at the federal level, coming out of the CDC, and they make some changes, they make some statements, decisions, and we don't. Sometimes there's a bit of a lag period, right, before it gets through the state system, and then comes down. It comes, from the state. Once they make that decision, it comes to the counties, very quickly. But we have to allow those processes, to happen. So sometimes, certainly there's some frustrations in that, and everybody feels those. But I think they're getting better at that flow, and it's moving a little bit faster than perhaps it has, in the earlier stages here. So, but it's just an area that we have to recognize that's part of what we have to live by, and it's, we're doing it in California. Structure is doing it to, ensure that we're protecting, our folks, our residents and people in the state, to the best of the abilities. So, any other, last comments, perhaps I'm not seeing any other questions. I would close with a couple areas here, that this has been a long road, right? We're 14 months plus, 15 months, into this, by some of the official actions. It's been a tough road. It's been hurtful for people personally. It's been hurtful economically, incredibly hurtful economically. It's been very tough and hurtful on people, on behaviors, their mental health, our children. I just so admire everything that's, been done, and the stamina that people have, held up to this. And it, there's been moments, certainly, what I would ask, for the health of our county, coming from the board, certainly from public health arena as well, is that we remain ever vigilant, right? We keep doing our part. We keep getting vaccinated ourselves. Some people feel if they've only gotten one shot, they're good. Well, that's a good step, and it offers protections. But really, that second shot is what buttons it up and makes it so much more solid. And encourage, right? Encourage your family, your friends, your coworkers. The more people that we can get vaccinated, the better off we're going to be. And that target age group, right now, that 18 to 49, that's a group that we really need to concentrate on and do everything that we can to, talk to those people and convince them that this is, something that's going to be for the overall health of not only in their lives, but the health of the communities. So, with that said, I think, Dory, if you have any last comments on your end?
Nope. We really appreciate folks tuning in. We've been doing this. We'll, continue to evaluate the need and the desire of the community for these public health forums. We might move to a different platform like Facebook Live of Dr. Surjenko, because that seems to be working for other communities, but we'll see. But stay tuned. You can always find information on Tuolumne County Office of Emergency Services website or Public Health's website. Also, all social media will update folks. But right now, we've been doing these public briefings the first Wednesday of every month. So, as we get closer to the end of the month, we'll have a link and figure out if we're going to do this again on Zoom or if we're going to do it on another platform. So just stay tuned for that.
Yeah, we'll sort that out. This is an evolving, changing thing, right? So we'll look at it week by week. We'll see what information we get, and we'll base our decisions on what we're seeing, and what methods that we have to reach out, and how often we need to reach out. That's part of the equation. So I really appreciate the people coming on to the call and participating. I very much appreciate Dr. Surjenko taking your time to join with us again and help, explain and educate to the public. And Michelle DeCetta from Public Health, thank you so much too for everything you guys are doing, there. It's just an incredibly long road, and you guys have been at it for a long time. And, a lot of kudos to you. Thank you.
All right. Well, thank you so much.
All right.
Well,
So
thank
with
you,
that, I guess we'll close out the call then, huh?
All right, everyone be safe and have a great evening.
have a great night.
Okay. Good night, everybody. Thanks.